What other myths are there?
So I think kind of going off the back of the pelvic floor side of things, if you imagine your pelvis, this big basin, at the bottom of it you've got this bowl of muscles called your pelvic floor muscles. A lot of people haven't heard of them until they have a baby, because then everyone's kind of talking at you about them. But they're something you can exercise throughout your life, and it's quite important to exercise them, and we want to keep them nice and strong. So throughout pregnancy, the technique of trying to squeeze and relax those muscles typically every day is quite important. And the idea is that you're trying to think about trying to stop yourself from passing urine and passing wind. That's the action that you can kind of visualise as you engage those muscles and let go.
Cool.
Yep, really exciting stuff. And then there's other ways we can make it more interesting, but at its root, that's what we're basically trying to achieve.
Okay.
Lots of people are told that, or they read that towards the end of pregnancy you should stop doing them, because if those muscles are too strong you won't be able to deliver baby vaginally.
Yeah.
But actually that's a bit of a fallacy as well.
Okay.
So on the day when all the hormones kick in, if you're going to labour naturally, your body will help those muscles relax and baby will be able to come out. So there's more value in keeping exercising those for as long as possible.
And you said something about a C-section, like if you have a C-section you should still do it. But I feel like you're just like bypassing that, so you can just like, you know,
skip
not
them.
do that. Yeah.
Get rid of them. So absolutely, your pelvic floor is taking the same strain, particularly if you've been exercising and running during pregnancy, which again is not a negative, but those muscles have to work really hard. The amount of gain in weight we have over that 9-month period is quite dramatic, really. It's a good thing, it's meant to happen, but those muscles are doing a lot of the work to keep everything supported and look after your pelvic organs. So whether you have a cesarean or a vaginal delivery, those muscles have worked really hard and they need that support. The only slight kind of adjunct to that, where people might not need to do as much or might need a bit more assessment before they do lots of pelvic floor exercises, is if they've got any sort of chronic, what we call chronic pelvic conditions. Things like endometriosis, or things like having had vaginal pain when they've had inserting tampons, having penetrative sex, or having smear tests, and that might be an indication those muscles are actually very high tone, or I've got quite high tension is probably a better word for it, and those muscles are already very tight, and actually they need a bit of work to do some letting go.
To chill out.
Yeah, it's a little bit less common, but it can happen. So if you think you fit into that category, then it's worth having a chat with a pelvic health physio, which you can see privately or on the NHS, and just understanding a bit better what's going on for you before doing loads and loads of strengthening work. But for most people, they're important muscles to exercise regardless of how you deliver.